Our next speaker today is Eileen Fuentes from an organization called The Speech. She will talk further about empowering your team.
Okay. I'm going to ask you to join me on a quick trip down memory lane. Imagine being born into healthcare. I mean, literally being born into healthcare. Here you'll see my mother at her job that she had at a health insurance company in the 1970s when she was pregnant with me. And here I am with my grandmother who had kidney issues, and so 3 times out of the week she would go for her dialysis infusion. She was my caretaker while my mother was at work, and I was her translator. And here I am a little over 20 years later at the very same job my mother had at a health insurance company, having my own baby shower with my oldest daughter. I went on to work directly with the chief medical officer, and then later to Columbia University Medical Center, where I've been for 13 years, overseeing human resources and academic affairs. And here's my 3 daughters. And as you can see, they're healthy and strong and vibrant, maybe a little too energetic. But one of the things I did as a parent, even though parenting is incredibly chaotic, is I would take them to their doctor's appointments always on time. And my point here is not to talk about what a great career I have or what a great parent I am, but simply just to highlight that I knew healthcare. I knew it from a business standpoint, I knew it as a healthcare management professional, and I also knew it as a consumer. So let's look at this definition of the word healthcare. Healthcare is defined as the prevention, treatment, and management of illness, and the preservation of mental and physical well-being through the services offered by the medical and allied health professions. And it wasn't until I became a patient myself that I realized that I didn't know everything about healthcare. On September 19, 2008, I was diagnosed with the stage 2 and the very aggressive triple-negative breast cancer. I went on to have a bilateral mastectomy with reconstruction. I had multiple surgeries, and I underwent chemotherapy for 5 months. And with chemotherapy, I had nausea, vomiting, complete hair loss. I went from a size 12 to a size 2, and along the way, I developed a blood clot in my heart. But what was scarier than chemotherapy was the lunch. This is what I was fed every 2 weeks when I walked into the chemo suite. And as you can see, there's a cocktail of high fructose corn syrup, caffeine, chemicals, sugar, and I had a choice between tuna, ham, and turkey sandwiches, all of which are loaded with sodium nitrate and are a known carcinogen. I also got cookies, cakes, and ketchup, which I'm assuming is the one serving of fruit as it is in the elementary schools. And at this time is when I really started to look at how food can actually, before that, I used to look at food as a way to lose weight. I went from one fad diet to another. And at this point, I started looking at food a little closer at how it could help me to heal. And what I realized is that I knew nothing about healthcare. I knew nothing about food. I knew nothing about nutrition. And so I started going in deeper into formal training when it came to 4 different areas related to cancer care. I started out with holistic nutrition. I went on to integrative cancer care. I went into patient navigation, and I ended with health supportive cooking. And it was at this point that I had a conversation with my breast surgeon to talk about how maybe some of the things that I was learning, I can teach to others, and he agreed. And in October of 2010, I started a wellness program in Washington Heights, where I was working at Columbia. And I met amazing women along the way. And it was great to connect with women that were dealing with the same issues that I was. But while I was the youngest one in the group, I was 34 when I was diagnosed, and most of the women that I was teaching were a lot older than I was, but they had different issues than I did. The first question that I had to ask myself was, what if I had no health insurance? What if I didn't speak the language? What if I relied on public assistance to fulfill my basic needs? And what if I didn't directly benefit from the free mammogram initiatives, but the care that came after it? So let's talk a little bit about breast cancer disparities, particularly for women of color. When it comes to white women, they get breast cancer more, but African American women die at a higher rate. And while Latinas get breast cancer at a lower rate, they're being diagnosed at later stages, and so much like African American women, they have a much lower survival rate. Both of these groups are also being diagnosed younger and with much more aggressive disease like I was. So let's talk a little bit, let's switch gears a little bit and talk about what a health nut is. When you think of a health nut, what do you think of? I generally think of a health nut as a thin hippie with a yoga mat. They're always sipping on green juice. They look a little like this. And what I started to realize is that the women that were walking into my group were very different from this. And I'll tell you a little bit about a few of them. The first one is Nilsa. Nilsa is a hardworking woman who came to this country when she was a teenager, and she worked as a hairstylist. She taught herself English and had to stop working after having breast cancer surgery due to the swelling she had in her arm after her lymph nodes were removed. And then there was Chenny. Chenny is one of the sweetest, most nurturing women I've ever met. And when she brought up the fact that she had a pre-existing heart condition with her oncologist, he literally fired her as a patient. He threw her out of his office. And then there's Charlene. Charlene is a young single mother of 4 special need kids who is disabled and is dealing with an advanced cancer diagnosis. But I want to focus more closely on Mercedes. By the time I met Mercedes, she had had 5 strokes, 3 open heart surgeries, breast cancer twice. She had debilitating body pain, she could hardly breathe, and she was overweight. So much so that she had to have her home attendant bring her across the street to come to the program. She literally lived right across the street from where I was teaching. And here's Mercedes a couple months into the program. She lost 40 pounds, and even the home attendant that used to bring her to my program lost 20 herself. And while I'd like to take credit for all of this, before I go and say that, there was one point where these women were going out into the community, into Washington Heights, and they started talking to people. Before you knew it, we had a journalist come to one of our programs. And I just want to read to you what Mercedes said in her newspaper article in the Manhattan Times. She says, and these are in her own words translated into English, "This program is so wonderful. I've learned so much. It's changed how we're all living. This has made a big difference, and that makes me very happy. I lost weight and I have energy." And while I'd love to take credit for all of the things that she said, I have to just tell you yet another story about Mercedes. One day as I was sitting in my office, I get a frantic call from Mercedes, and she's in the emergency room. And she's having a hard time translating to the doctor, telling her all the symptoms that she was having. And as we're sitting there, this man walks in, and I thought he was her brother. Turns out he was her 91-year-old father. And as we were waiting and waiting and waiting, the waiting room is not lying. He started to tell me a little bit about his upbringing in the Dominican Republic, how he grew up on a farm. And in this farm, he ate all the food that he grew. He hung out all day with the animals and thought they had healing properties. He had a close connection to his sisters and his mother. But the most shocking revelation was when he told me he had 9 children, the oldest being Mercedes at 60, the youngest being 10 years old. Yes, and he had 2 other children that were under 21 years old. So the reality was that the secret to a long life was right there. It had nothing to do with me. It was essentially teaching them about going back to their roots. Particularly with this group, what we tend to think is that this isn't about us, it's about the health nuts with the green juice. But in reality, this is our reality. And when you look at it, you see all these plant-based foods. You see the people that they're together. You see the fact that they're working to make this food, and so they don't have an obesity issue. They're vibrant, they're happy, they're joyful, they're living with purpose. But on the other hand, this is our reality. This is what the United States looks like. And this is the reason why we're number 30 when it comes to healthcare systems. But here's where we're number 1. We're number one in obesity, and we're number one in spending. So this is what a health note looks like in my opinion. This is, in my world, this is what it looks like. And you'll see Charlene there, the first day she met Kale, and you see us doing yoga. And actually in that picture on the bottom is all the people that were doing a class of mine. And in there were their children, were caregivers, there were clinical staff in there was a breast surgeon at one point, and we never turned anyone away. And we didn't just stop there. We actually taught about many different subjects. One of them was Qigong. We did traditional Chinese medicine. We talked about Reiki, prayer, meditation. We did a healthy cooking class. We had makeovers using organic and vegan makeup. We talked about responsible breast cancer fundraising because they slap pink ribbons on everything and they're not giving us any of this money. And also we talked about sex. And then it went even further. These women really started pairing up. A lot of them couldn't work because of their situation, so they started pairing up and going to doctor's appointments together, demanding the dignity that they deserved. And then I thought, this was a story I was telling myself in my head, that these women would never embrace all these hippie, foods that I was introducing them to, but they actually took it and they made it their own. They started adding sea vegetables to their plantains and their beans. They started putting turmeric in their arroz con pollo. They started doing quinoa in their sancocho. And they started adding kale to their avocados. And just one point, as I'm talking about doctors, I just want to highlight something that I actually heard earlier in one of the presentations. Because I oversee what doctors do every day in my day job, I know doctors are incredibly busy. And so it's not them, they are not the enemy. We're all part of this broken system. And I want to highlight a study that I saw in the New York Times by Dr. Pauline Chen, who I think is incredible. And she talked about a large-scale study done in Minnesota called the Patient Activation System. The study found that those who were more involved in their health were less likely to smoke, be obese, get hospitalized, or go to the emergency room as compared to those who were less engaged. And while more affluent patients tended to be healthier than those who were poorer, patients who were more active in their own care tended to be in better health than their socioeconomic peers, regardless of income. And it went on to say that those who were the most activated had significantly lower healthcare-related costs than those who were least activated. So it is my opinion, as a patient, not as a healthcare worker, that people do really good when things go really bad. Everybody benefits when we are allowed to take care of our own health and healing. We want to be an active participant in our own health. It works for everyone, the doctors, the patients, the caregivers, the patients' families, the community. What we have is really not sustainable. And so I'll leave you with this. What should we do? If I had to find a healthcare genie to give me 2 wishes, this is exactly what I would wish for. I would wish that we improve the quality of the foods that we're giving our patients in the hospitals. We shouldn't be getting, thank you. This is not the place for chemicalized processed junk food. And if I had a second wish, I'd ask that we had more patient activation-like wellness programs and make it a reimbursable expense. We have the right and the desire to be part of our own recovery because I believe if you allow us, we can take charge of our own health. Thank you very much.